We had some losses that came up that did lead us to genetic testing because we had
Moving
two
forward.
losses. Yes, we had a loss that was at 10 weeks and one at 16 weeks that were both found out that could have been detected. And that was hard for us because it just emotionally, those losses were so hard because they were further along, and just like they were so traumatic, especially our 16-week loss of delivering that baby. Like that was just, there was a lot of trauma there. We did further digging though before we did the genetic testing because it didn't sit well with me of like what is viable and what is inviable.
Yeah.
And because I have a daughter with a genetic condition and special needs, and she's amazing and a miracle and one of the best things to ever happen to us, I didn't want someone to tell me that she was inviable. So once we did thaw our embryos and we had them, we had the genetic report back, we once again had a phone call with a genetic counselor through iGenomics, and she went through every single embryo with us and explained exactly the ones that were abnormal, what was wrong with them, and what their chances were. And I mean, also, I should add, the genetic testing, pre-genetic testing has come a long way in the 7 years since we've had our daughter. So it could now test for very small, different genetic abnormalities like our daughters. And I think with genetic testing too, really checking into your clinic and their procedure, their process with it, because I guess I see other people on Instagram and on social media talk about how many normal and abnormal embryos they got, and kind of just like immediately like push those abnormals to the side like they don't exist anymore. And we've gotten some questions of like, oh, doesn't your clinic just automatically dispose of the abnormal ones? And that is not true for our clinic. Every single one of our embryos were refrozen, are still frozen, and under mine and my husband's control.
And so you have to make the decision.
We have to make the decision. And so I think when people hear about genetic testing, they think, oh, you're like letting them decide what to do. And I think maybe some clinics do that.
Well, I'm guessing what happens most often is that people just say, what do you think we should do, doctor? And the doctor would say, we should get rid of these 4. And they say, okay.
Yes, exactly.
I'm sure that's probably how it goes.
Right. Whereas, yeah, that was not the process
but
at
you
our.
Could say no.
Yeah. At our clinic, all of ours were refrozen. They still exist. They are for us to make the decision, the final decision and final say. And yeah, it's not like they were just thrown out.